One of the things we're going to talk about is food allergy. And in the realm of food allergy, there's a couple of things that are relatively new to bring to people's attention. One is a condition called eosinophilic esophagitis. So eosinophils are, of course, a type of white blood cell that tend to show up at sites of allergic inflammation. So patients who have nasal allergies have eosinophils in their nose, and patients who have asthma have eosinophils in their lungs. And so there's a relatively new condition where people have had swallowing difficulties as the main presenting symptom, food sticking, who turn out to have lots of eosinophils in their esophagus. And those patients then are often referred to the allergy clinic for evaluation to see what part food allergy could be playing in those symptoms. Most of the patients actually come to us from the gastroenterologist. So if a patient presented with food sticking to a general internist, it would be most appropriate for them to see the gastroenterologist first. After they've had a workup in GI, including an endoscopy, where these eosinophils are found, then they're often sent to the allergy clinic. And we look into other allergic diseases because many of these are patients who have the other genetically allergic diseases, asthma, hay fever, eczema, and the other kind of food allergy where you would have an anaphylactic reaction to food. So they often have those conditions. And then we're still kind of wading through what part allergy plays in the eosinophilic esophagitis. There are some patients clearly where eliminating certain foods will be very helpful. There are some patients even where being allergic to seasonal things like pollen seem like it contribute to their eosinophilic esophagitis. So from the allergy standpoint, we're trying to sort out what part allergy could be playing in their symptoms. Well, given that this is a relatively new diagnosis, it's certainly well known now, I think, in the gastroenterology community. It's recognized there. So it is actually, it does seem like a relief to most patients by the time they get to the allergy clinic, because oftentimes these symptoms have been coming on over a period of months or often years. Patients sometimes learn to kind of compensate by chewing their food more thoroughly or avoiding certain kinds of food, and then it just gets to the point where they realize something's obviously wrong. And I think it's part of it is just a relief to the patient to understand that this at least is a recognized condition, and we know that it goes along with other allergic diseases, and that there's something that we can do in terms of avoidance that might be helpful. Even for patients who can't alter their diet as a means of helping this, where there isn't a particular food that seems to be causing it. Like other allergic diseases, eosinophils are exquisitely sensitive to corticosteroids. And just as we have patients with allergic rhinitis use corticosteroid nasal sprays, and we have patients with asthma inhale corticosteroids for their asthma, we can have patients swallow corticosteroids to coat their esophagus. That's also a very effective treatment for this eosinophilic esophagitis. We have them swallow the corticosteroid in a form that actually coats their esophagus so that it'll remain in contact with the esophagus for long enough for it to be effective. But it has been very effective as a treatment for that condition. Well, there's two things actually. The first thing that was done was to have people intentionally misuse their asthma inhaler. So rather than inhaling it, they squirt it in the back of their throat and swallow it. So in swallowing that powder, that kind of coats the esophagus. The other thing is that we can take corticosteroid that would otherwise be intended for a nebulizer machine and thicken it up with Splenda or some other sweetener to make it viscous, and have the patient swallow it at bedtime and then immediately lay down and go to bed, so that that also remains in contact with their esophagus for a while. They usually only have to do it once a day, and it's a condition that tends to come back if they stop treatment. So it's something they're going to be doing indefinitely. But the amount of corticosteroid and the fact that it's swallowed and has high first pass metabolism, where it's metabolized very quickly from the gut, they're not really at risk to have any kind of corticosteroid absorption or systemic side effects from that. And it's often a very effective treatment.